Again, so this presentation is a little bit different. It's not scientific. Let's see, I'm not sure why this is jumping ahead. So this is not really a scientific presentation. This is really talking about sort of a concept and an idea that we have that we're beginning to work with to create some of these educational videos for the purpose of physicians, nurses, physical therapists, and for our patients. Okay, so OrthoNations is our organization where we come to developing countries, to other countries that have different abilities for us to work with and teach, and then we bring fellows. We have multiple fellows that are here who've come to the United States for our fellowship, where we sponsor having them come over and learn for a few months. And that's what OrthoNations is. Anyways, recently with COVID, with the inability to travel and to have any kind of direct contact, the concept was to begin to create some educational videos that can transition without sort of being in one place together. And so the idea of these videos, which is what we're beginning to do and beginning to put online, is to create sort of these free public access videos that can be used, and they're going to be directed into various topics between surgery, physical therapy, nursing, and even patient education. And so the main key here is that these are videos that are produced that are low cost, low technique, not low technique, but certainly low cost videos. And by that I mean low cost techniques. So obviously when you work for a major company, they have very adept teams that put together very expensive videos that show you how to use their expensive implants. But for many people around the world, they don't have access to expensive implants, and therefore it's really not useful. And so our point is that we want to find ways to get the job done that can be effective and can do a good job, and yet use low-cost techniques, things that people in hospitals that have limited resources, people in the countryside who have limited resources, and even limited training can accomplish. All right, so we're breaking this down into different things. Obviously, most of the people in this room here are surgeons, and so we think of things from a surgical standpoint. There are office procedures. So there are office procedures. It's interesting to me that there are many people who, some of the things that we take for granted that everyone would know are not necessarily common everywhere. So knowing how to give a good injection into the shoulder, even the knee, or into the wrist or the elbow. These are techniques that are certainly something that is easy to explain and easy to demonstrate, and will give people the opportunity to do office procedure, doing trigger finger releases, even carpal tunnel releases. Some of these procedures that can be done in the office with local anesthetic are also a great, easy thing to demonstrate, so people don't have to come to the hospital for a small procedure in a big, busy hospital. There's the surgical techniques as well. Again, in our country, this is a quadriceps tendon graft. It's becoming more and more popular over time. I think it's going to be one of the most popular grafts for ACL reconstruction in 5 years and in 10 years. We have very expensive pieces of equipment that we use to help us harvest the graft, and yet we put a video that just shows how to harvest the graft just simply with Mayo scissors, and you don't need anything special, and so anyone can do it in any place. Rehabilitation, I think it's been mentioned many times in this conference, which is that good surgery without rehabilitation is going to be a bad result. And so in many places, people do not have access to get to physical therapy. If patients travel 2 hours to come and visit you for surgery, they don't necessarily have the opportunity to come back for physical therapy. I'm just going to demonstrate that once again. So for patients that are in the countryside and far away from where they can easily get care, hopefully that will load once again. Anyways, you have the ability to sort of show this to your patients, and we're going to try to break this down into different phases of rehabilitation. So the first several days after surgery, and then the few weeks after that, and then the months after that. And so even if your patients are off, and these are all going to be home-directed exercises, but later we'll actually do things that actually can educate physical therapists, because physical therapists in certain areas have minimal training, and so it's easy to demonstrate how to do these hands-on techniques. And these are some of the things that our physical therapists have started to help us put together. From a nursing standpoint, there's certainly many aspects of nursing that for some of us in busy orthopedic hospitals, we take for granted as just being the standard of care, and yet in many places, the nursing training, it is not really specialized towards orthopedics. And so there's ways that we can try to teach and educate the nurses that are on the floor on how to take care of our patients so that they have great care in the hospital, so by the time they leave, they're already in a good position. They've been taught and educated, and they've started early motion if that's appropriate. And then, one of our goals is to try to put this in many languages. We have some of these that we've started to do in Vietnamese and Spanish. You can go to these videos, and if you check the settings on the bottom, you can change it to the language of your preference. And so then you can have, here's Arabic here at the bottom, but you can have, the video will be in English. I think that's easiest for us, and many people have sort of said that to hear English in the background is not a bad thing to hear, so that you can kind of develop your skills with language learning in English, which has become sort of the international language for medicine in many ways. But it allows you to put the subtitles on the bottom so that you can see it and read it in your language, in Vietnamese, while you watch the video and listen to the video in English. How can you help? That's, for our question, we put time and effort into creating these videos, and when we do a procedure in the office or in the operating room, if we think that this would be something that would be applicable, then we'll tape it. And we're not doing anything fancy. We're getting a video camera and sometimes our iPhone and just moving back and forth, and then we spend time in the evening and we put these videos together, and our young doctors are busy working away to create these videos so that we can create some of this content. But really what's important is what is important to you. And so from my standpoint, this is an opportunity that we've learned many things, and I say this to people in America all the time. When we come, we learn so much from our doctors here in Vietnam and in other places, because you have to work with limited resources, and because of that, you find tricks and techniques that are unique to us. And so if you can reach out to us and sort of tell us, hey, listen, I have this idea, whether you've taken this technique, then we can help to put all of this together and try to create a video that, instead of it just being used in your local hospital with a few doctors around you, we can put it online, and then people from all over the country and all over the world will have the ability to see this and to learn from what you are doing on your own. And so, you can go to, and we're just beginning to put all of this online, so if you go to YouTube and search OrthoNations Academy, you'll see some of the videos that we've started to put on over the last few months. And we're just at the beginning of this process, but our goal is to continue to build on this every month, try to add new videos. And we want those videos to be things that are appropriate for you. Again, they're going to be low cost, low technique. We've seen some amazing things at this conference. Some high-end stuff that's extremely complicated. But the truth is that if you can't do it everywhere, then it's less valuable for what we're trying to do here. It may be fantastic in big cities, and even in big cities like Hanoi and Saigon, where there are hospitals with great resources. But we're really kind of focusing on the hospitals with limited resources. So anyways, I would encourage you to take a look at the information that we have and reach out to us. And I think here's my email, Teo Mendez, who's out here as well. This is his email, so if you have anything that you want to reach out to us, then feel free to send us an email, and we'll work with you to kind of create content. Thank you.